Hello, heart heroes. Have you ever wondered what happened inside your body when you break a sweat? Whether you are dancing, jogging, or just chasing a dog, your heart is the most valuable person of the movement. So today we are learning about effect of exercise on a cardiovascular system. So we see two type of effect on a cardiovascular system. One is the acute effect and another one is a chronic adaptations. So let's talk about the acute effect. What are the acute effect when we do exercise? So here we are mnemonics. The mnemonics is how runner become powerfully vitalized, in which how H stands for heart rate, in runner R stands for respiratory rate, become B stands for blood pressure, powerfully P stands for peripheral vasodilation, and vitalized V stands for venous return. What happened to these components? So when we talk about the heart rate, usually we see when we do workout or exercise, we see our heart rate get increased. Why? Because to fulfill the demand of the oxygen or blood to the body, that is why the heart rate get increased. When we talk about the respiratory rate, what happened to the respiratory rate? We breathe faster to inhale more oxygen and to exhale or blow out the carbon dioxide. So that is why our respiratory rate get increased. When we talk about the blood pressure, we see when there is more demand, more pressure on the heart, we see more perfusion of the blood, and that leads to the increase in the blood pressure. And when we talk about the increase in the blood pressure, we mainly see increase in the systolic pressure. The fourth one is peripheral vasodilation. What happened to the peripheral vasodilation? What is this? So when we do exercise, our muscle get contracted. Our muscle get contracted, then we see our muscles which is supplied by any vessels, it get expanded to get more blood from the heart and to supply to the body. That's why we see there is a peripheral vasodilation or expand of the vessels. When you talk about the venous return, due to the more contraction of the muscles, it helps to push back the blood to the heart, which leads to the increase in a venous return. So we have done with the acute effect. Let's see what happened to the chronic adaptation. Here we have a few mnemonics, which is fixed heart, in which P stands for pulse rate, H stands for hypertrophy, I stands for increased stroke volume, T stands for total peripheral resistance, H stands for heart rate recovery improves. Let's learn more deep about each component. First, we see pulse rate. We see there is a decrease in a pulse rate. Why there is a decrease in a pulse rate, or we can see resting heart rate? Because due to the adaptation, our heart become more efficient so that it supply the same amount of blood in one beat only. It don't need to pump again and again to supply the same amount of blood. That's why our pulse rate or heart rate get decreased. And because of this adaptations only, our heart become hypertrophic. Our heart muscles become hypertrophic, we can say, mainly the left ventricle. That's why we see there is physiologically hypertrophy of the cardiac muscles, which is known as the athlete's heart. We see there is an increase in a stroke volume. Because of the adaptations, our heart becomes so efficient that it pumps more blood in one beat only. That's why our stroke volume get increased. Total peripheral resistance. When we talk about the arteries, our arteries become more elastic so that it perfuse more blood. Because of that, there is a less resistance in the arteries, due to which the total peripheral resistance get decreased. So when we talk about the heart rate recovery improves, what happened due to the chronic adaptations? When we do exercise, during the post exercise, there we see there is a faster recovery in the heart rate, and because of that, it leads to the fitness of cardiovascular system. So let's talk about the clinical tips. What happens when we do regular exercise? When we do regular exercise, we see there is a decrease in a hypertension, there is a decrease in the risk of stroke, there is a decrease in the risk of heart failure. We also see that exercise boosts the HDL, that is high density lipoprotein, and reduces the LDL, that is low density lipoprotein. It boosts HDL and it reduces LDL. HDL, we can say HDL is a good cholesterol and LDL is a bad cholesterol of our body. So what happened to our insulin? It improved the insulin sensitivity. Thanks for turning in, and don't forget to move your body and love your heart.